For centuries, tuberculosis or TB has been one of humankind's most elusive scourges. In 400 BC, the Greek physician Hippocrates identified TB as the most widespread disease of ancient Greece and noted that it was almost always fatal. Today, TB is still a highly contagious bacterial disease that is easily spread through the air by coughing and sneezing. In 2011, more than 1.4 million people died of tuberculosis. It's the second leading cause of death from an infectious disease worldwide. Anyone can get TB, but the disease is especially common among poor and underserved populations. More than 2 billion people, one-third of the world's total population, are infected with TB bacilli, the microbes that cause the disease. However, for most people, the infection is dormant because it is controlled by the body's immune defenses. They do not have any symptoms and they cannot spread the disease. But when someone becomes sick with active TB, it can be easily transmitted to others. A vaccine with limited effectiveness, BCG, was developed in France in the 1920s and is still given to infants in many countries. BCG does not protect against infection, but it can prevent the most dangerous forms of TB, such as TB in the brain and bones. It offers no protection to adolescents or adults, which are the groups responsible for nearly all transmission and in which the most deaths occur. And unfortunately, a growing number of people are getting a multi-drug resistant, or MDR, form of TB, which means it can't be treated with first or second line drugs. In many cases, TB is associated with HIV because HIV affects the body's ability to fight infections. In many countries, TB kills up to half of all people living with HIV/AIDS. But there is hope. We have made remarkable progress against both TB and HIV in the last few years. In the space of 17 years, 51 million people have been successfully diagnosed, treated, and cared for according to the World Health Organization, or WHO. Without these services, 20 million people would have died. This milestone reflects the commitment of governments to transform the fight against TB and work toward elimination of this public health problem. The U.S. Agency for International Development, or USAID, is a global leader in scaling up effective interventions for the prevention, diagnosis, and treatment and care of TB worldwide. USAID and WHO are working with host country governments, the Global Fund to fight AIDS, TB, and malaria, and international partners to dramatically reduce TB. We have a goal of cutting in half TB deaths and prevalence by 2015 through the Stop TB strategy and the Global Plan to Stop TB. The U.S. is focusing efforts on strategies to improve case detection and treatment, address MDR-TB, and TB-HIV. It will also continue to innovate and further our knowledge through research and strengthen overall country health systems. For example, we are supporting the expansion of high-quality TB diagnosis and treatment services, including community-based TB care, which brings services closer to patients and reduces the burden of TB on families and households. These activities are aimed at identifying more cases through early diagnosis and achieving high cure rates, which reduces TB transmission and prevents development of drug-resistant TB. Early diagnosis of TB is important so that patients can be quickly treated and the health community can control the spread of the disease. To that end, the U.S. government is also supporting the worldwide rollout of GeneXpert, a new diagnostic device that can test patients for TB, including drug-resistant TB, in under 2 hours. The fully automated test, called NAT or NAAT, can diagnose TB and rifampicin-resistant disease and is now available in 67 low and middle income countries. Finally, the U.S. government is supporting intensive efforts to build the skills and awareness of health providers, communities, and patients to understand and address the diagnosis, treatment, and care of people with MDR-TB. From supportive national programs on how to manage second-line drugs to training for community volunteers who monitor side effects and support patients for up to 2 years of treatment, we are helping to address this public health challenge. TB mortality and prevalence has decreased by 35% in USAID-supported countries since 1990. Over 1.4 million TB-positive patients were successfully treated in 2010, and over 44,000 people with NDR-TB were enrolled in treatment through U.S. government-supported programs, a significant improvement since 2010. There is also the promise of medical breakthroughs from new TB drugs, the first in over 40 years. Indeed, tools to prevent, detect, and treat all forms of TB are steadily advancing through research and development. Further down the line, progress could mean that we will have a new, shorter treatment regimen, a diagnostic test that can be performed at the first point of care where someone with TB symptoms seeks treatment, and eventually an effective vaccine which could be available within the next decade. But the global fight against the disease remains fragile. We are now at a crossroads between TB elimination within our lifetime and millions more TB deaths. We can eliminate TB through partnerships, research, early diagnosis, advocacy, and social mobilization. By identifying cases early and treating new and existing cases, we can create communities around the world that are TB-free.